how can public institutions best work with pharma companies to help find a cure or vaccine to the coronavirus?
Yeah, I think one of the silver linings to the cloud of coronavirus has been the way that governments have worked with pharmaceutical companies, research departments and other in a really collaborative way to try and find not only vaccines, but any kind of medicine or therapy that will help reduce the risk and the cost in lives that we've seen. The UK, I think, actually, possibly because it's had such a difficult time, has done very well in this regard. You look at the recovery trial out of Oxford, which uncovered the fact that dexamethasone actually does have a positive impact. You look at the Oxford and Imperial trials on vaccines, working incredibly closely both with pharma companies, but also sponsored by government to make sure that happens. So that is a positive. I think we're seeing that happen at a speed that it hasn't before, with a level of interest from government institutions and departments and Treasury critically like never before. And actually, if you throw forward to the future, what this might do is to get governments to think more about their health services as R&D platforms, not just as places that buy medicines, but actually places where medicines are developed. And of course, you know, if you've got a single national paying health service like we do in the UK, that could be a massive boon to R&D.
Thanks. And looking at the track and trace system that's about to come into play in the UK, can that get us back to normality before we find a cure or vaccine?
Yeah, I mean, that we have to, because, you know, the truth is vaccine development takes time. It doesn't always succeed. We don't have a cure for other coronaviruses like colds. So we have to be prepared to do whatever it takes to get back to normality. A massive part of that, as other countries have shown, whether that's Germany, South Korea, and so on, is having a really robust system of testing everyone who's symptomatic, tracking the people who they have been in touch with, and making them self-isolate. Now, what's interesting about this system is that technology and data can help you do this in a way that is much more sophisticated than traditional means. And one of the goals we've got to do is to make sure that that is completely thorough, that everybody gets tested who needs to, which we are now doing, and that we get hold of people who have been in touch. Obviously, there's been quite a lot of interest in how phone apps can do this, but they might be part of the story. But what about children who are at school? They might not have phones with them. What about vulnerable adults who you don't want to be tracking them, but we might need to use new digital technologies? So it's quite exciting in a way that this is a very fast developing set of technologies. And of course, critically, I think everyone's aware that it needs to be ready for winter in the Northern Hemisphere at any rate, when we're expecting obviously seasonal flu and colds, and we've got to be able to distinguish who's got COVID and who's got colds, or else a hell of a lot of people are going to be at home who should otherwise be at work because they've just got a cold. But casting even further forward, how could we use this for other purposes, for so-called dual use? You know, are there other purposes these systems could be put to? So it's an investment that pays off not just in the next year or two, but for decades to come.
Thanks. And moving on to talk a bit about education, we're just talking in the UK about trying to get kids back to school. I know they've started to in France and other places in Europe. How do we stop there being a permanent damage done to a generation of children who have taken all this time off school?
Yeah, to be honest, I'm really worried about it. I'm worried about it as someone who's been involved in education and as someone who's a parent of 3 children. And the costs are twofold. One is the cost of education, put the pause. You know, lots of schools have done their best, but online education is of the kind that's been delivered as a pretty poor substitute for the real thing. Of course, that does affect everyone who's at school now, sort of similarly. So you could say there's a levelling effect there, albeit a levelling down. But the other effect is of course psychological, and I think lots of children have been cooped up for months on end, and that's been true in lots of other countries as well. Possibly exposed to, in some cases, to more domestically violent households. You know, it's obviously a huge amount of people, adults have anxieties about their jobs and bringing that home. So I think there's a psychological effect. So what we need to do to correct that is twofold. Firstly, we need to get into those the children back to school, obviously, with extra catch-up help for those most in need of it. But I think we shouldn't ignore the mental health impact on children as well. We need a really, really thorough system of going into schools, trying to find out which children have been worst affected and making sure that there's sort of psychotherapy and other support that they need. Happily, that is happening. That was happening anyway in the UK, but it now needs to happen much, much quicker.
Great, and we've talked more broadly about this crisis having a particular effect on young people, obviously not health-wise, but in terms of the generation that is said to struggle financially, has already been through a financial crash for the young generation in work. How's it going to affect the concept of an intergenerational contract, and what implications might that have for geopolitics worldwide?
There's definitely the big macro impact from coronavirus. Because if you look at the data, it's affected people in very different ways, health terms and economic terms. In health terms, if you look at the UK, if you're under the age of 45, you'd be no more likely to die in the first 6 months this year than you were in the first 6 months of the last 5 years on average. Of course, if you look at the over 80s, the over 85, if you get coronavirus, you've got something like a 20% chance of dying. So the health impacts are completely different. The economic impacts are almost inverse. If you're older, you own your own home, maybe you've got a pension, you're pretty secure. But of course, if you're younger, financially insecure on your first or second job, you may have been furloughed for a period, but there's a really good chance you're going to lose your job. So the younger generations have taken a hit in order to keep the older generations well. And I think people are willing to do that, in the sense we're all in it together. But as we move into the recovery, that has some really profound effects on the way that we need to do the economic recovery. And I would pick two things. Firstly, climate change. That is the ultimate legacy of the kind of behaviours that have been going on for a long time that younger people are going to have to bear. And I think the politics of climate change is going to come even more to the fore and be even more urgent. The second is around helping younger people get the kind of assets that older generations don't have, but they don't have themselves. Whether that's housing, pensions, more intangible assets like education and so on. And so there's going to be getting the politics of that right is going to be important. You already see it coming to crunch time in the UK with the question of the so-called triple lock on pensions, which has kept pensioners' income fairly stable for the last 10 years. But that becomes unaffordable and actually unfair while you're going through this recovery period. And so even though this was a massive pledge from the Tories at the last election, there's a pretty good chance that they're going to at least pause this pension lock for a few years in order to help younger people catch up.
Great. And finally, looking at what governments can do better in future, how can they better prepare for pandemics of this kind, and what can they learn from this one in future instance of a breakout like this?
So for future pandemics, I think what's interesting, and there's going to be many books written about this, is the fact that the US and the UK were judged to be two of the best prepared countries for pandemics and have had some of the worst experiences in terms of loss of life per capita. There's a chance, I think, that they were almost too well prepared for the wrong kind of thing, for flu pandemics. And of course, what happened was not a flu pandemic, but a SARS pandemic of the kind that, of course, we have seen smaller outbreaks in previous years of SARS and MERS and so on. So what that tells me is that you can almost have too good a plan. And if you follow your plan without understanding what the reality is, that's when you get into trouble. So the first thing is obviously much greater flexibility in understanding pandemic risk, not just focusing on one type of pandemic, but pandemic risk in general. More domestic resilience, supply chain for things like medicines, for things like PPE, but also into food and consumables, areas where global supply chains have also fallen short occasionally. The second thing is people are more interested in their health than ever before. Everyone is conscious of the risk to them, their families, but also the risk of them transmitting disease to other people. If we get to a situation where, for example, in the UK, everyone has an NHS app, that app is telling them whether they've come into contact with people who've been ill, but also whether they've been in places where infections have broken out, you can use that to help them manage their risk factors. You can give them nudges in terms of public health messages, but you can repurpose that kind of technology to help them manage their health risks for things like cancer, cardiovascular risk, and so on. So when I'm feeling optimistic about all of this, I can see a situation in which there is a much more distributed responsibility for people taking care of their own health through technology, being able to understand the risks that they face and doing something about it and improving their longevity.
Brilliant. James, thanks a lot for speaking to Chartwell this morning.
Thanks.